Screening for sleep-related disorders in the pediatric population is a growing need that can be addressed in a cost-effective manner by means of informing public health policy. Several factors influence the need to address the growing problem of sleep disorders in children. For example, there continues to be an increase in autism spectrum and neurodevelopmental disorders. Parents of children with these disorders report higher levels of concern with regard to sleep. When this is juxtaposed to the critical role that sleep has on the development and function of the brain, its potential effects become more critically important to address. More specifically, neurodevelopmental disorders in general, and autism spectrum disorder in particular, show deficits that are attributed to functions of the frontal cortex, temporal cortex, and cerebellum. All of these are areas in the brain that are particularly affected by poor sleep. Also consider that 50 years ago, 10 times as many children slept an average of 8 hours per night. Today, most school-aged children are reported to sleep less than 6 hours per night on average. Even though additional scientific studies and data are needed to fully inform recommended levels of sleep across the developmental spectrum, this trajectory is headed in the wrong direction. While sleep disorders in and of themselves do not account for this change in sleep habits, this statistic underscores the need for addressing both quality and quantity of sleep in the pediatric population. In fact, a cursory review of over 40 pediatric questionnaires that are used to assess constructs ranging from the acquisition of developmental skills to evaluating behavioral function revealed that none of these measures address sleep to any meaningful or functional extent. This raises the question of whether the development of a standardized, multidisciplinary screening process would improve early identification of sleep disorders by establishing a mechanism for referring children who are identified to fall at risk for more comprehensive evaluation and/or treatment as appropriate. Despite the fact that additional research is needed in this area, there is a significant body of literature that supports the need for healthy sleep. For example, studies have shown that healthy sleep has a positive effect with regard to enrichment of neurons as well as the development and maintenance of neural networks. However, these appear to be underexpressed in children with neurodevelopmental and autism spectrum disorders. We also know that healthy sleep plays a role in the reduction of inflammatory responses, such as those observed with glial cell activation. Interestingly, these have been found to be overexpressed in children with autism spectrum disorder, a phenomenon that may also be present in other neurodevelopmental disorders. History shows that prudent changes in public health policy can have a significant effect in reducing neurodevelopmental risk factors. For example, when a public health policy was established to screen children for lead poisoning, we were better able to identify those who were at risk and reduce, if not eliminate, continued exposure. Similarly, the Back to Sleep campaign proved to be an effective initiative in addressing various concerns with the infant population. In an analogous manner, the development of an effective screening and evaluation process for identifying disorders in sleep would help inform the need for effective treatment. As such, it is imperative that sleep hygiene become a priority of public health policy. While additional research in sleep is clearly needed, screening for sleep-related disorders in childhood would increase awareness and thus promote the need for additional scientific research. The development of effective screening is a necessary first step. Establishing healthy sleep, which often improves behavioral functioning, is likely to result in reductions in health-related costs. There is also the need to address the issue across cultural and socioeconomic strata in order to ensure equitable beneficence. Current social norms and cultural values may be promoting unhealthy sleep through the inadvertent practice of reducing exposure to melatonin-related activities and over-reliance on the use of stimulant medications to address behavioral concerns. The implementation of screening for sleep can be readily incorporated within existing well-baby visits and does not present significant legal barriers with regard to violation of privacy rights. Similarly, outcomes data may also be gleaned through the analysis of data that is routinely gathered in both healthcare and education-related statistics, not to mention additional research interests that may result from increased awareness. With the implementation of the Healthcare Affordability Act, children will be provided with comprehensive preventative services, making the introduction of a sleep-related questionnaire opportunistically feasible.